Good evening, everyone. This is a summary for the orientation session given by Dr. Mazen Dardiri and I for the FRCS Part 3 Glasgow exam. Actually, in this orientation session, I'll talk about three main topics. The first one is the exam structure. The second one is how to study and how can I be prepared perfectly to pass this exam from the first time, or to raise my likelihood to pass, or my chances to pass this exam from the first time. And the third part is regarding our course, the schedule of our course, and how can we help you pass this exam from the first time. Okay, regarding the exam structure, which is the first part of this orientation session, I have 3 Viva stations and 4 OSCE stations. In the Viva or oral part, the first section is neuro-ophthalmology plus internal medicine or emergency medicine, to be accurate. In this part, you have 5 problem-solving cases or questions, 2 cases for emergency medicine in the form of case scenario mostly, and 3 cases for neuro-ophthalmology. Actually, the questions are in the form of photos, which is common. You are asked to describe what you see, what is the lesion, what are the positive signs, what is the spot diagnosis or the differential diagnosis of this, and then the discussion starts. Or in the form of case scenario told by the examiner, almost the 2 internal medicine or emergency medicine. Like, for example, you do have a patient with a comatose patient in your clinic, and this patient is known to be diabetic. How can you manage? What is the differential diagnosis, and so on? This is the case scenario. So the case scenario is common for the 2 internal medicine cases, and ECG, which is not common recently. But actually, ECG will be covered in our course. So here we cover it because we want to raise the chances for passing the exam from the first time. Okay, the neuro-ophthalmology station may include uveitis. Yes, but uveitis in relation to systemic disease like sarcoidosis. So it is somehow can be an internal medicine question, because you will be asked about the relevant systemic manifestations and how can you manage, or how you can manage such a case. Examples of topics. This is for New Delhi 2022 exam. The first case was acute chest pain, joint cell arthritis. These were the internal medicine 2 case scenarios: myasthenia gravis, sarcoidosis, and pituitary adenoma, and that is for the neuro-ophthalmology part. Regarding the posterior segment, you do have 6 questions in the form of photos. Again, you are asked to describe, and then discussion starts. Case scenario told by the examiner. This is not that common for posterior segment, because in posterior segment and retinal diseases, you have many photos. So photos are easier to be introduced in the exam rather than the case scenario. Okay. Examples of topics. Also for the same exam: glaucomatous optic disc description for differential diagnosis, glaucoma workup, rhegmatogenous retinal detachment, PTR, Paget's disease, and Coates disease. Regarding the anterior segment, it is almost the same like posterior segment. You have 6 questions in the form of photos. Actually, this is anterior segment plus oculoplasty, so it is not an anterior segment or just anterior segment. You do have oculoplasty here added to this station. So 6 questions in the form of photos and case scenarios. Okay, examples: acute dichroic cystitis for differential diagnosis and management plan. Actually, everything regarding, so in any question in the Viva or in the oral exam, you have to know everything about it. You will be asked about everything about it. Okay, complications of intravitreal anti-VEGF injection, cataract surgery in suspicious posterior capsular rupture case. And this is common actually to be asked about. How can you manage or how can you do the cataract surgery in special situations like pseudoexfoliation, like in cases like this one, suspicious posterior capsular rupture case, and so on. Fungal keratitis, traumatic evaluation or trauma evaluation, and penetrating trauma management these were the examples. Okay, that is for the Viva part. So in the Viva part, you have 3 stations. The first is neuro-ophthalmology plus emergency medicine. The second is posterior segment and glaucoma. And the third is for anterior segment and oculoplasty. It is not necessary that you start with neuro-ophthalmology in the exam. This is according to your number. So you are rotating. So one candidate will start with neuro-ophthalmology. The other will start with, for example, posterior segment. And the third one will be asked about anterior segment. In the OSCE, we do have 4 stations. The first one is the anterior segment. You do have 4 patients, or 3. Actually, in New Delhi, they were 3. In Cairo also, I think the last one, they were 3. They are present in the examination room or the clinic, and candidates have to finish or pass at least 2 cases within the specified time. If you finish more, then you will raise your chances to pass the exam from the first time. So you have to be quick. You have to be trained well. You have to practice more and more and more in order to do this quickly and in order to comment quickly and structure your answer. That's why actually we introduce this course in English. Actually, we speak Arabic, but this is our second language. But it is important to construct your answer. That's why we introduce this course in English. Actually, in the course, we will ask you, for example, I'll give you a photo and I'll ask you, like in the exam, how can you describe this and how can you manage a case like that? I'll ask you the relevant questions regarding these photos or the photos introduced. Okay. In the anterior segment, examples also in the New Delhi exam, keratoconus on slit lamp, you will see the irregular curvature or irregularity and thinning from the cone. Actually, this was evident. In any case, you ask the examiner or take the permission from the examiner to examine the other eye. So in the exam question, examine the right eye. Actually, after examining the right eye, you may ask the examiner to check for any signs in the other eye. The second was the corneal opacity, and the third was Marfan syndrome. Okay, there are 3 constant questions in almost all cases. What are the positive signs? Forget about the negative signs. Don't mention anything about the negative signs, because actually your time is valuable, and you have to finish at least perfectly 2 cases. Okay. What is the diagnosis and the differential diagnosis, and how can you manage in order? These questions are in order. So what are the positive signs? The first one, what is the diagnosis or differential diagnosis? Actually, because in some cases you don't have the exact diagnosis, but you mention the differential diagnosis, and how can you manage such a case? In posterior segment also, you have 4 patients or 3 according to the center offering the exam. 4 patients are present in the clinic, and candidates have to finish or pass at least 2 cases within the specified time. Actually, this is for the 4 stations, the anterior segment, posterior segment station, and also for the oculoplasty station and the neuro-ophthalmology and strabismus stations. Okay. There are 3 constant questions in almost all cases. What are the positive signs? What is the diagnosis and differential diagnosis? And how can you manage in order? Okay. Examples for posterior segment, all central retinal vein occlusion, retinal vasculitis for differential diagnosis, and macular hole. Neuro-ophthalmology and strabismus. Here for neuro-ophthalmology and strabismus, and the other one, the last one, which is the oculoplasty, the technique is much more important than knowledge. Actually, both of them are important. So you have to know. And I think that most of the candidates sitting for this exam have the knowledge. But actually, how to construct your answer in order to be clear or as clear as possible. Don't show off, just answer the questions, the relevant questions with the relevant answers. With order. This is much more important, or this is important actually, but here in these stations, neuro-ophthalmology and strabismus, the technique is also important. The technique is much more important indeed. Okay. Candidates have to see at least one neuro-ophthalmology case and one strabismus case. So the first case, for example, will be neuro-ophthalmology. The second will be strabismus. The third may be neuro-ophthalmology and strabismus. And so on. The technique of the exam or of examining the patient is extremely important. This is what I said regarding neuro-ophthalmology, strabismus, and also oculoplasty. Okay, so examples: relative afferent pupillary defect, sensory exotropia, and exophoria. The fourth station and the final one for patients, or which is oculoplasty for patients, or three are present in the examination room. Candidates have to finish or pass 2 cases within the specified time. Actually, this is a rule in all stations. This is a rule in the exam. Okay, the technique of of examining the patient is extremely important, actually more important than knowledge. So you have to practice more and more. Examples: lid skin nevus, ptosis, and sclerocornea. The second part of this orientation session is how to study. How can I study, and how can I be prepared, well prepared, perfectly prepared for this exam? You do have sources like Wong, which is the main source of ophthalmology examination review. Actually, you have to read this more than one time. Oxford Handbook, that is, and Kansky, one of them or both of them, just for revision. I know that you have read at least one of them, Kansky or Oxford Handbook. But if you read Oxford and you revise from Oxford, be sure that you remember the photos, because here in Oxford you don't have any photo. There is another book which is called Viva and OSCE. This book, if you do have some time after finishing Wong and revising from Oxford or Kansky, you can read from this book. This is called, famous as the Blue Book, actually. This book is much more important for FRCS, not FRCS. But if you do have some time, you will get benefit, some benefit from this book. Previous candidate experience, which is present in CHOA page. This is also extremely important, because cases and the candidate's experience, like, for example, some candidate failed to diagnose some disease or failed to describe some disease, and that's why he failed the exam. So here you may get benefit from his experience. And high-yield questions from Wong Viva. This book, I think, may be read in just 2 days or 3 days after finishing or after studying all of that. And that is for the Viva part, not for the OSCE part. Okay, so here Kansky or Oxford Handbook, that is just for revision of the clinical sciences. And here, this is the main book. This one, which is Wong, this is the main one. Okay, the ophthalmology examination review. You have 2 Wong books, actually. This one is the main one. You have to construct your answers according to this book. Actually, if there is something called the ideal answer is in this book. The examiners are expecting your answer from this book. If you forget something from this book, then the examiner may ask you what else. So you have to read this book more than one time. This one, Viva and OSCE exams in ophthalmology. This is for FRCS. As I mentioned before, if you do have extra time for studying from some other sources, this one will be perfect for you. Cakewalk, actually, this is for emergency medicine. The part of emergency medicine, if you read from Cakewalk, I think this may be enough. That is how to study. Okay, how to study for the OSCE. Again, Wong and Wong. Actually, this is the most important one. Choa for the examination techniques. Viva and OSCE book. In the second part of this book, you will have OSCE cases and the relevant questions about the OSCE cases. And again, the previous candidate's experience. So here, this is Choa for the examination techniques. This is, I think, about 20 pages or 30 pages at most. Viva and OSCE, that is for the second part of this book, which is for OSCE. You have to read them. Actually, this is not necessary, but if you read them, this will add something to you. And that is show a page for the candidate's experience. As you see, the candidates write down how can they pass the exam, sorry, and how can how did they pass the exam? How did they fail the exam? This is extremely important. Okay, look at this slide and make it like a rule. The examiner should feel that you have done these techniques over 100 times, because hopefully we have already done this. Okay, so here from day one, if you have to sit for this exam, like in March, like in May, like in June, you have from day one, from tomorrow, to practice all the techniques of oculoplasty, the techniques of neuro-ophthalmology. If you don't use the indirect ophthalmoscope regularly, you can use it. If you don't use the direct ophthalmoscope, that may be required for the neuro-ophthalmology station. So hopefully you do this hundreds of times or over 100 times. The third part of this orientation session is our course. We do have 25, we'll offer 25 sessions. In the Viva part, this is the schedule. I do have 3 sessions for neuro-ophthalmology, motility disorders, and actually we had this session. Pupil and nystagmus, also we had this session, and optic neuropathies, ECG, emergency medicine, systemic diseases with uveitis. That is for section 1. Section 2 for the second station of the exam, which is the posterior segment and glaucoma. Vascular retinal diseases will be the first session. Macular diseases, the second session, and fundus dystrophies, this will be the third one. The fourth one will be glaucoma, relevant photos, questions, plus complications of glaucoma surgery, which will be or may be required for the exam. The sources for all parts or all sections are the same sources that I mentioned, or the same books that I mentioned. And I told you that these books must be fulfilled in order to be perfectly prepared for this exam and pass, hopefully, from the first time. Section 3, the last one, cataract and cataract surgery will be the first one, lacrimal system, orbital diseases, lid malpositions, lashes disorders, and lid tumors, corneal diseases, keratoplasty, and eye banking. These are the 5 sessions for anterior segment and oculoplasty part. Sessions will be introduced in the form of questions. How can we make it useful? Actually, this will be different from studying the clinical sciences. For example, I won't start by talking about optic neuritis. Actually, I'll start by a question like that. A 22-year-old woman reports decreased vision and eye pain in the left eye that started 2 days ago. So here I do have eye pain and decreased vision, and a 22-year-old and woman, and has gotten worse. She says everything looks blurry and appears dimmer with that eye. What is the diagnosis? Actually, here look at the fundus photo. The fundus photo is telling us that there is no abnormality seen. So this is a normal fundus photo. Normal fundus photo with decreased vision and pain with ocular movement. This is typical for retrobulbar neuritis. So instead of talking about optic neuritis, I'll make it like that. Actually, the Viva part, I'll introduce the Viva part. Dr. Mazen Dardiri will introduce the OSCE part. Okay, and here the relevant questions as you see. So after that, we will have the access to optic neuritis, and then I'll ask you the relevant question, which are the possible questions that you can be asked in the exam. Also, I do have 2 revision sessions for selected cases from case review book. This is also a good book in order to in order to revise from such a book. Again and again, Wong is enough. Wong is a very good book together with the part of emergency medicine from Cape book. But in relation to ophthalmology, Wong is enough for the Viva part. But actually, this book will put you in the atmosphere of the exam. This one, which is case reviews in ophthalmology. In the OSCE part again will be introduced by Dr. Mazen Dardiri. I'll talk instead of him. Okay, so the first session will be related to the lid plus oculoplastics. Will be related to ptosis examination, proptosis examination, lid malposition, diseases, and dead tumors. Actually, this will be introduced with videos of how to do these, and actually we recommend that you open your camera and open your video while being online and do the steps as we mentioned, and we will give you comments about the technique that you do. This is in order to be interactive and in order to get the best use of these sessions. Okay, this is the first one. The second one, the OSCE will be every Friday actually. The second one is neuro-ophthalmic examinations and strabismus. This will be given in 2 sessions. Neuro-ophthalmic examination like pupil examination, visual field testing, direct ophthalmoscope tips, and possible questions. The second will be related to strabismus, so it will be cover, uncover, and motility testing with the relevant questions and the relevant possible cases. You may be asked about third nerve palsy, for example, divergent strabismus, or also for you will be asked about the motility in such a case. Another example for this is exophoria, for example, sensory exotropia. You may be asked about maybe sixth nerve palsy, and so on. In the anterior segment, Dr. Mazen will introduce 2 sessions for the possible cases and relevant questions. Actually, how to use the slit lamp. I think all of us know how to use the slit lamp, but actually, also this will be, we can give you some tips and tricks in order not to forget anything while doing these examinations. Posterior segment also will have 2 sessions, possible cases and relevant questions. That is our schedule. Also, there will be 2 sessions and with hands-on for Egyptians. We will rearrange this again for the date and time and place. Actually, this may be in Alexandria with Dr. Mazen Dardiri, or we can make it in Cairo. We didn't agree about the date and time and place for these 2 hands-on sessions. That is for the orientation of the FRCS Part 3 Glasgow exam. If you do have any question, just feel free to ask me or ask Dr. Mazen. Thank you.